Torticollis and plagiocephaly are two common pediatric diagnoses that can impact a baby's normal development. CMT, torticollis, is an acquired postural deformity characterized by a tight sternocleidomastoid muscle, SCM, which causes the baby to rotate their head away from the tight SCM and laterally flex their head towards the tight SCM. Plagiocephaly commonly occurs in conjunction with the torticollis due to the abnormal neck posturing and causes flattening of the parietal occipital area of the child's head, anterior shifting of the ipsilateral ear, and busing of the forehead. The American Academy of Pediatrics initiated a back to sleep program which recommends that infants be placed on their backs to sleep in order to decrease the incidence of sudden infant death syndromes. The back to sleep campaign fulfilled its purpose by reducing the prevalence of SIDS by 50%. However, an unforeseen consequence of the program was a doubling in the prevalence of torticollis and plagiocephaly. The AAP recognized this shift and released additional recommendations in 1996 that promoted tummy to play, which encourages the baby to be placed on their tummy during waking hours to allow the baby to meet developmental milestones and to prevent torticollis and plagiocephaly. While back to sleep is widely known among caregivers, 55% of mothers report receiving information on tummy to play.
The incidence of plagiocephaly in the United States ranges between 8.2% to 19.7% and peaks at the 4 months of age. This indicates the importance of screening and intervention prior to 4 months of age in order to prevent positional plagiocephaly. This is also indicated for education towards parenting about positioning during the awake periods for an infant's day to help promote healthy and normal development of the infant. Other education is regarding formable nature of the newborn's head and preventative measures of positional plagiocephaly by the time infants are 2 to 4 weeks old. Monitoring all these will help address the concerns about missing educational pieces of expecting mothers and caregivers about tummy time to play, as Aneem stated in her slide earlier, that only 55% of caregivers and parents received information about tummy to play.
Novel prenatal education course on prevention of plagiocephaly and torticollis has been a continuation study consisting of 3 phases. Phase 1, the development of prenatal education course that highlights the importance of tummy time to prevent plagiocephaly and torticollis and gather content validation by pediatric experts and a parent. The research team made changes based on the panel's feedback to have a finished course script, outline, and teaching methods for the prenatal education course. Phase 2 objective was the pilot study of the prenatal course in Bismarck from January 2019 to April 2019. The research team educated expecting mothers and caregivers through a 1-hour session based on the lecture and lab format as designed in Phase 1. Participants also completed the Upstart Parent Survey, a prenatal pre-post survey to analyze demographic information and responses to determine if improvements in parenting knowledge and experience occurred as a result of attending this prenatal education course. Our current phase, Phase 3's objective, was the revision of the prenatal education course through continued review of the literature on prenatal education and prevention measures for plagiocephaly and torticollis to further develop the methodology of this research project. Overall, the purpose of this research project was to enhance parents and caregivers' knowledge on supervised tummy time while the child is awake through prenatal education course in order to decrease the severity and/or prevalence of plagiocephaly and torticollis. However, the purpose of our phase as a group was to update the methods and protocol by continuing review of the literature on prenatal education and prevention measures for plagiocephaly and torticollis so that we can move through the submission of IRB through Stafford Medical Center.
The updates and revisions that we have completed in this phase included finding a valid survey to assess parents' knowledge from the prenatal education course, a sample of which is on the right-hand side of this slide, and implementing a free well baby screening for infants between the ages of 8 to 12 weeks to determine the efficacy of the prenatal course on preventing plagiocephaly and torticollis in children whose parents may or may not have attended the prenatal course. Currently, we are still undergoing IRB review with particular attention to coding to maintain the highest level of participant confidentiality within the research study. Within our protocol, we wanted to determine how effective the prenatal course was on preventing plagiocephaly and torticollis. So our research design consisted of a prospective single-blind cohort study. Our control group will be caregivers who did not receive the prenatal education course prior to Well Baby, and the experimental group will be caregivers who participated in the prenatal education course prior to the Well Baby measurements. So our independent variable would be mothers and caregivers participating in the prenatal education course, and the dependent variables would be the presence and severity of plagiocephaly and brachycephaly and the presence of torticollis.
Throughout Phase 3, the research team has been focused on developing an appropriate survey to assess parental knowledge after attending the education course. The data collection survey has been edited with permission from Leonardson and colleagues to reflect the prenatal education offered by the University of Mary's Doctorate of Physical Therapy students, which will be used to assess how the education provided to the parents helped prevent skull deformities in the first 4 months of their child's life, as well as require parents to answer questions on the information taught within the prenatal course or determine if the parents attended the course at all. Throughout the process of IRB approval, we have received many suggestions for changes to our study's protocol. The suggestions for change to obtain IRB approval included the priority of patient confidentiality and clarification on the storage of participant data during data collection. The research team is continually making changes to meet the needs for coding processes to connect the mom and the baby during the different phases of data collection to maintain patient confidentiality, as well as proper storage of participant data during the data collection phase. This is a continuation study through the Department of Physical Therapy. Following IRB approval, Phase 4 of this research project will consist of providing the prenatal education to the expecting parents during the second or third trimester of pregnancy within the Sanford Medical Center in conjunction with the baby basics classes. This allows mothers time to adequately implement the knowledge learned from the course into the child's care. Our primary hypotheses of this study are that this educational course will increase parents' and caregivers' knowledge about the effects of plagiocephaly and torticollis and how to prevent these conditions, as well as infants whose parents attended this prenatal course will show an increase in awake tummy time and demonstrate a decreased prevalence and severity of torticollis and plagiocephaly at 8 to 12 weeks of age. This will help researchers note if the frequency of torticollis or plagiocephaly is influenced by attendance and participation in the prenatal education course on tummy time. Data analysis on the severity of plagiocephaly will be completed to try and identify an association between caregivers' attendance to the prenatal education course and the prevalence of plagiocephaly.
We would now like to take the time and thank Dr. Emmel, University of Mary Physical Therapy Department, members of the Sanford IRB team, and Freda Lardinson and colleagues for allowing us to utilize and edit the survey. If you have any questions, we can answer them via the discussion board. Thank you for your time.